There are ways that the healthcare system itself can be improved in such a way that to accommodate the needs of persons with disabilities and improve the quality of care for all consumers, regardless of their disability status. And the question we have today is, what can we do to the healthcare system to make the healthcare system universally accessible? What would a universally designed healthcare system look like? What changes can we make that will allow healthcare to be accessible to all people, regardless of their disability status?
I think, when you look at access for people with disabilities, there's great interplay in so many areas, and the topics we intend to discuss really overlap. Access is such a broad statement, but I'll begin by saying, the number of people with disabilities in the state and the country hovers around 20%. And so when you're talking about access, you're talking about a broad spectrum of people. Also, when you're talking about access, you're talking about making improvements for everybody, because when you improve it for people with disabilities, everyone benefits.
I think about my own recent experience with a dentist who told me that the severe decay in my gums did not need to be addressed, as the gums were not infected and it would be difficult to perform the procedure on a person in a wheelchair. That I use a mouse stick and rely on my teeth to access my computer, telephone, cell phone, and other pieces of electronic equipment did not at all figure into the dentist's treatment plan. Whether based on discrimination rooted in race, immigration status, disability, gender, sexual orientation, or other prejudice, the result is our current healthcare system that creates an invisible class or invisible classes of people. The barrier to these services is not the presence of an intellectual disability, but uninformed and prejudicial systems that treat the person as a disability, not as a person in need of culturally appropriate intervention. A person-centered health system is one that incorporates people with disabilities in their present condition according to their identified goal.
So including disability will add another force to push cultural competency forward. And this inclusion means, and I'll briefly hit on some of these, that healthcare professionals and staff are trained, not only trained, but exposed to people with disabilities. That there would be a diversified workforce, so the hiring and promotion of hiring of people with disabilities at all levels. A system that is more coordinated and patient-centered, so a partnership between the individual, family, if appropriate, and health provider. Collecting and analyzing data on disability because it shapes policies and practice. Enhancing communication styles, and also providing tools and resources in alternative formats. So this includes services for sign and language interpreters, TTYs, and other forms of communication devices. Systems and providers would assess their beliefs and views of disability and have an understanding also of how race and ethnicity impacts and perceives the disability.
One of the most fundamental issues in service delivery that affects those of us with disabilities is the institutional entitlement in Medicaid. Medicaid entitles people who need physical care with a chronic situation to services in a nursing home. It does not entitle people to those same services to be delivered in the community. Many, many efforts are being made under waivers and other ways of manipulating the Medicaid system to be able to provide these services in the home.
So I'm going to talk about healthcare disparities from the perspective of people with psychiatric disabilities and substance use disorders. In 2006, a landmark study was released which really crystallized this issue for me and a lot of other folks. And the results of the study showed that on average, people with serious mental illness live 25 years less than people without serious mental illness.
Now, we all have to work together to make sure that we enact policies that fully reflect the needs of people with disabilities. I can't tell you how much I appreciate the stories that we've heard and the questions that have been asked. As was said at the beginning, we're all better off when our system is accessible and responsive to all people and the needs for everyone. Healthcare for All, we spend a lot of time talking about the need to make sure that our system is culturally competent and accessible, and that means for all of us.